the cervical spine. The cervical spine comprises of 7 cervical vertebrae that are numbered from the cranial or head end towards the caudal or tail end. C1, or the atlas, is the vertebrae that articulates with the occipital processes of the skull. C2, or the axis, articulates with the atlas at the atlantoaxial joint. C3, C4, C5 and C6 are deemed to be typical cervical vertebrae, whilst C7, or the vertebrae prominens, is deemed to be atypical along with the atlas and the axis. A typical cervical vertebrae has a bifid spinous process. The vertebral body is somewhat smaller than that of those within the thoracic and lumbar regions. And the transverse processes have transverse foramina, which are holes that transmit the vertebral arteries and veins. It is worth spending some time looking at the zygoapophyseal joints. These are the joints between the superior articular process and the inferior articular process of vertebrae. And the angle of these joints explains the wide range of movements permitted at the neck, namely flexion, extension, and lateral flexion.